Hot Springs Health. I want to talk about pulmonary function testing. So pulmonary function testing is important because we can measure the capacity of your lungs and figure out how well you're transferring oxygen in and out. These tests help us to clarify what's causing certain symptoms, measure how severe your lung disease is or how severe a lung condition may be, and track how well treatment is working. So our respiratory therapists will coach you through this test and help you do what you're supposed to do in the right time. So if you're having issues with ongoing shortness of breath, chronic cough, wheezing, talk with your provider about whether a pulmonary function test may be right for you. There are certain conditions that we know a provider would want to order a pulmonary function test for, and these can be when you know you have asthma or COPD. It helps us with people with COPD to know what your baseline is. It also helps if you have a COPD exacerbation and we want to follow up with your symptoms and see if you're getting closer back to your baseline. The box behind me is what we use. It's called a body box. It simply is like a phone booth that we have you sit in. We have you breathe into this instrument that tells us the capacity of your lungs. So it can show us something called spirometry, and this measures how much air you can blow out and how fast you can get air out of your lungs. Some conditions like COPD or asthma, you trap air, and this will help us to know if your lungs are clear full of air and they're not being able to expire that air out. It can also help us to know if you have a restrictive lung disease and you're not able to put more air into your lungs because they're scarred or because they don't have as much expansion as they normally would. We can also check a bronchodilator response. So we can, during this test, we can give you a spray of albuterol, and this can help open up your lungs if you have some restriction from COPD or from asthma. This tells us that your lungs have improved after we do the medication or not, and this can give your provider some more information as to medications that may help you manage your symptoms more. So we can also look at your lung volumes with our pulmonary function tests. Lung volumes are how much air your lungs can hold, how much gets trapped, the difference between obstructive or restrictive patterns. It can also tell us how much oxygen can get into your bloodstream from your lungs. And this is important to know, do you need oxygen normally? Will that help you feel better and move more oxygen around? And sometimes scarring or air trapping in your lungs from COPD or emphysema or chemical exposure can prevent that. So you may need oxygen, and this will help us kind of elucidate that a little bit better. Most of our visits take about 30 to 60 minutes. We're trying to find all those answers in that amount of time. So your respiratory therapist will be working with you and coaching you during the test. When you are finished with your tests, your results will go off to a pulmonologist to be read so that we know what's going on. We can figure out what to do with those results, and it will be sent back to your provider, and then you can have an appointment with your provider and meet together and figure out a diagnosis, figure out what the best treatment would be, and work with them to feel better and to get on the right treatments to help you breathe better and feel good. This is our pulmonary function tests. If you are having issues and know that you want to figure things out or want to kind of understand your symptoms better, then you can talk to your doctor and get one of these tests ordered. We do them right here at Hot Springs Health.